procedures today. Could you state your name and date of birth for me, please? Okay, Mr. Vincent. So the doctor ordered a Foley catheter for you because you have pressure buildup in your bladder due to urinary retention. So we're just going to relieve that for you. So before we get started, do you have any latex allergies? No. Okay. Are you allergic to iodine? No. Are you allergic to shellfish? No. Okay. So I'm just going to perform some hand hygiene. I'm going to put on my gloves so I can perform perineal care for you. So I got my equipment, and I'm just going to raise you up. To a working position. Okay, so we'll pull back these covers. Okay, I'm going to lift your gown up. So I have my towel and I have my water, so I'm just going to clean in a circular motions. Okay. So I'm going to get rid of this, my basin, and I'm going to remove my gloves. And I'm going to wash my hands again. And I'm about to start the sterile procedure, but before we get started, I'm just going to explain what's going to happen. I'm going to insert this Foley catheter tube through your penis, and it's going to go to your bladder so we can empty it out for you. So now I'm going to start. I'm going to just take this out the bag. So use this as my garbage can. I'm just going to set this right here. And the position for this, if it's a male, I will put him in supine position, which he is in supine position. If it's a woman, I'll put him in dorsal recumbent. So, set this right here. Okay, I'm going to put on my sterile gloves now. I think I might have broken the sterile field. I might have. So. So I'm not going to mess with that. So I'll break that. I'm just going to move that out of the way. Okay, now I'm going to get my little sheath little thing so I can increase my sterile field. Okay. Slide this under here. Place it like that. Okay. Place that right here. Okay. So now I'm going to go ahead and attach my syringe to my tube or catheter. And I'm going to put the iodine on the cotton ball so I can perform perineal care. So I'm going to hold it and do circular motions outwards. Okay. Now I'm going to squirt this in here so I can lube up my catheter. So on the count of 3, I'm going to get you to hold your breath so I can insert it. So May have broken sterile field, may. So on the count of 3, I'm gonna get you to hold your breath. So 1, 2, 3. Okay, there you go. So I'll insert it all the way to the Y for a male. Okay, so now I'm going to insert all 10 cc's of this fluid to inflate the balloon so it can stay in the bladder. Okay, all of it's inserted, so I remove that right there. Then I'll pull back and see if it's in the bladder due to the resistance. So now I'm going to just tape this to his leg, secure it, or thigh, tape it to his thigh. Then I will attach this to a non-moving part of the bed below the bladder. So now I'm going to move my mess. And then I would pretend I have a towel and I will perform or clean him up after this procedure. So I'm going to cover him back up. Well, no. Yeah, I would. No, I wouldn't. I'll take a specimen. So I would get it from the bag just because I just inserted it, so it's fresh. But if it's been sitting for a while, I'll get it from the port with a syringe. So now I'm going to cover him up, get him comfortable, and put him back in a low position. I'll remove my gloves and I'll perform hand hygiene. And I'll be back, doctor's orders. Okay. Hey, I'm Tayana. I'm going to be your nurse today. Could you state your name and date of birth for me, please? Okay, I'm checking on your wristband. Okay, Mr. Vincent, the doctor ordered for your Foley catheter to be removed, so because your distended bladder has been relieved, so we're just going to remove that for you. So I'm just going to wash my hands and put on some clean gloves. I'm just going to put you in position. And what's going to happen is I'm just going to gently remove the tubing from your penis, as it, so come out your bladder. So, okay. So I'm going to pull this back. I'm going to empty the bag first of the urine, and I'm going to take this off your thigh. Okay. So I'm going to get my little syringe. And I'm going to insert it so I can deflate the balloon. So, okay, that's all of it. So now I'm going to gently remove it. So I want you to hold your breath on the count of 3. 1, 2, 3. Okay, so I'm just going to put this in a biohazard bag. Now I have a pretend towel to clean you up, make sure you're comfortable. Cover you back up. Covers back on you and put you back back in a low position. Okay. I'm just going to remove his gloves, and then I will document this procedure and the patient's response.